Hi, how's it going? I'm Madeleine. I'm going to be your nurse for the day. Could you tell me your name and your date of birth?
Chelsea Sandoval, 11/3/2002.
Okay, awesome. So we're going to go ahead and do a head-to-toe assessment with you, Chelsea, today. So that's just an assessment where I start at your head, move down to your toes, and make sure everything's okay. All right? All right, let me get my gloves on. All right, so let's start at your head. So I'm just going to feel for any lumps or anything. Look at the back of her head for any skin breakdown. All right, start looking at her ears for any skin breakdown there. All right, now I'm just gonna look inside both of your ears for any redness or drainage. Okay, nothing, everything looks good. All right, her skin, the color pigmentation of her skin looks appropriate for her ethnicity. She is not diaphoretic. Her skin's warm to the touch. All right, so I'm gonna shine a light into your eyes. If you could look straight ahead for me. All right. And then if you could focus on the tip of my pen light. Good. So her pupils are round and equal bilaterally. They're reactive to light bilaterally, and they also accommodate bilaterally. Okay, there's no drooping in any of her facial features. Everything looks symmetrical. And then I'm gonna look for your nose for any drainage or polyps. Okay, everything looks good there. Could you cover one side, breathe in and out, and then do the same with the other side? Okay, so her nares are patent bilaterally. All right, could you open wide and say ah? Okay, so her mucous membranes are moist. There's no deviation in her tongue when it sticks out. You can go ahead and close. No teeth are missing, so it looks good. All right, I'm just gonna feel around your neck for any inflammation. Does anything hurt there?
No.
Okay. So now I'm just gonna feel your carotid pole. Other side. Okay. 2+ bilaterally. And then can you move your neck side to side and up and down? Okay, so she has full range of motion of her cervical spine. Could you shrug your shoulders up? All right, so she has good strength in the shoulders. Now I am gonna move down to your arms. So again, her skin looks appropriate for her ethnicity. Do you notice some bruising on her right bicep? Hair distribution seems to be equal throughout. And I'm just gonna feel your brachial pulse. Okay, that's a 2 bilaterally, and I'm gonna feel that's a 2+ bilaterally. All right, and I'm just gonna look at the joints in her fingers for any redness or swelling. Okay, cap refill is less than 2 seconds. And then if she did have an IV, I would inspect the insertion area, follow the tubing, and inspect the flow and fluid was correct. All right, so could you grip my fingers? All right, so she has 5 out of 5 strength and grip. All right, so now I'm gonna move down to your chest area. So I'm gonna listen to your lungs in the front and the back, and then I'm gonna listen to your heart, okay? Okay, so I'm just gonna move your hair a little bit out of the way. Okay, so again, her skin looks appropriate for her ethnicity. There appears to be no skin breakdown at inspection. All right, so if you could take a deep breath in and out. Okay, in and out. All right, in and out. In and out. I'm gonna go right here, kind of underneath your. Okay, and then this side. And I'm gonna go back here and just listen. Okay, in. in, out. In. Okay, good, thank you. All right, so there were, her lung sounds were clear bilaterally in the anterior and the posterior. And I was just taking a look at her skin as I went underneath her arms, and everything looked fine. Okay, so now I am gonna listen to your heart. Listen to the aortic valve first. Okay, pulmonic valve. Herb's point. Tricuspid. And then the mitral. This one I am gonna listen to for a minute, okay? Okay. So her apical pulse was at 72 beats per minute, and everything sounded good. All right, so now I am gonna move down to your abdomen area. If you could lay down on your back for me. Okay, so just gonna take a look, your abdomen area. So I'm just looking at the contour of her stomach. It appears to be flat. Everything, her skin looks appropriate for her ethnicity. It seems to be there's no incisions or any skin breakdown anywhere. So I'm just gonna take a listen with the different parts of your stomach. Okay. All right. I'm just gonna listen over her genes just for the sake of it. All right, so there were active bowel movements in all 4 quadrants. Now I'm just gonna apply a little bit of pressure. You tell me if you feel any pain, okay? And have you been having regular bowel movements?
Yes.
You been having any problems with like urination or anything like that?
No.
Okay. Okay, so she didn't experience any pain. I didn't feel like any distension of the bladder either. So everything was good there. Okay, so now I am gonna move down towards your legs, okay? Just gonna cover you a little bit. Okay, so just gonna feel her skin. Feels warm to the touch. Okay, her skin, the pigmentation of her skin is appropriate to her ethnicity. Hair distribution seems to be equal throughout. There are no signs of DVT that I can see. And I'm just gonna feel your pulses here. Popliteal pulses. Okay, 2+. Just gonna feel your post-tibial pulses. 2. And your dorsal pedis pulses. Those are a 2+. All right. Now I'm just gonna look at your skin underneath your heels, underneath your feet. It's gonna break down. All right, and then I'm not gonna take your socks off, but I would check cap refill. Make sure that it's under 2 seconds. And then if you could sit up on the side of the bed for me, just so we could test the strength of your legs. All right, can you push your legs in towards my arms? Good. Out towards my arms. Awesome. Up. Nice. And then back. Good. And then if you could put your arms in a 90-degree angle. In. Out. Down. And then up. Good. She's got 5 out of 5 strength on all her upper extremities and lower extremities. All right, Chelsea, thank you very much. That's the end of the head to toe.
Thank you.